Hello, I'm Dr. Edgar Campos from Mexicali Bariatric Center. Today I want to talk about acid reflux or GERD. Overall, acid reflux is a disease that happens in around 12 to 18% of American people, so it's very common. Sometimes we can live a full life having reflux and probably having over-the-counter medication without the real acknowledge that something is wrong. Most of the time, acid reflux it's a disease that can happen over the day or during the night, and it can give you symptoms that is not basically related with acid reflux. So, what we feel when we have acid reflux or GERD, it's a little bit of burning sensation or heartburn in the chest. We can feel some pain, we can feel some discomfort when we're eating, and during the night we can feel that the acid, as long as we move back or we lay down, the acid return back to the throat. Sometimes a lot of patients have problems with the dental, and they have caries and they have some issues with the mouth, and they don't know that they're having acid reflux. So in that case, we need to talk with your odontologist, and we need to review it if that dental problem it's caused by reflux. Sometimes the enamel of the tooth are disrupting or are getting a little bit more acid than the usual, and you can have problems. Another cause of some disease like allergies or back of the throat itchiness or coughing every day, it's because of acid reflux. So basically, which our patients can have reflux is a wide open disease. It's normal to have either if you're a man or if you're a woman. There's no difference about sex. It's normal to have it or increase acid reflux over 40 years old, 35 to 40 years old. Acid reflux increases in all the disease or in any condition that increase the abdominal pressure, like pregnancy or obesity. So if you're obese, basically you can have more acid reflux than the normal because high pressure in the abdominal wall because of the fat. Visceral fat can give you reflux. Smoking can give you more reflux than the usual. Spice can give you more reflux. So basically, if you smoke, if you drink, if you're obese, if you're over 40-year-old and you have that burning sensation, we need to check you. So basically, acid reflux, it's quite simple to review. The first test that we can do to look directly if you have acid reflux, it's an endoscopy. And endoscopy, it's a visual study where we can review all the tract, and then we can take samples of the tissues and we can send it to pathology to check that acid reflux is not causing problems. Sometimes we can find a hiatal hernia. If we can find a hiatal hernia, this could be a cause of the acid reflux. But there are some cases that even the endoscopy is normal, we don't find a hiatal hernia, and you still have reflux. So we have different options. Either we can do on a manometry, that is a test that will review the pressure of the lower sphincter, and we can know if that sphincter is opening and relaxing. Most of the food that can cause pressure on the sphincter, which means more pressure of the lower sphincter, that means less reflux. It's protein and good healthy food. The food that relax that sphincter and promote reflux, it's fat, carbs, spice, caffeine. So what we advise is control your reflux at the very beginning with the diet. Meanwhile, we can do the proper testing. Right now you can get over-the-counter medication like any Nexium or Protonix or any IBPs. So IBPs will control the reflux, but if we don't know the real cause of the reflux, basically we need to look for a further treatment. One of the questions that we get to ask very often is, I can have a bariatric surgery, any kind of procedure, if I have reflux? Yes, you can. Normally, If the reflux is good and you have a hiatal hernia, we can fix that hiatal hernia and we can do a weight loss surgery without any problem. If you already have a weight loss surgery and you have reflux, then it's a different story. So I invite you to watch our next videos. There'll be a series of videos if you already have a weight loss surgery and what can you do if you have acid reflux. Thank you.